Ray Hanley is the CEO of the Arkansas Foundation for Medical Care. He's a frequent contributor to our program. He and I caught up recently on the latest on the Omicron variant, and also we discussed the growth of Medicaid in Arkansas. Hanley, a former Medicaid director for the state of Arkansas, has a unique perspective. Let's begin with the Omicron variant, which has been dominating Arkansas health policy and politics this month of January. Kind of give me an assessment of where we are. Do you feel like we're towards the tail end of this in Arkansas? Or are we still deep in the middle of it?
Well, I think in Arkansas, we're still deep in the middle of it if you look at the hospitalization numbers, which are truly alarming. Hopefully, we're going to follow the trend that's seen in some other states and certainly other countries around the world, where there is a hopefully rapid ebb of new cases. But I don't think we're there yet. I think the peak reached Arkansas, later than it did a lot of other places, and it may be that the decline is going to take a little longer here. But again, the thing to really watch are the hospital numbers, because they're really stressing the hospital healthcare system right now.
When I look at Arkansas's vaccinations and booster shots, we are making some progress. It's incremental on there, but we have moved up percentage-wise in those numbers. It's still not enough to get us any higher in state rankings per se than some of the other states. We're still kind of in that bottom 5 or 6 percentage down there. What are you seeing in terms of vaccination rates? Do you think that this Omicron variant is moving people to get more vaccinations, or do you
moving them
think it has not
incrementally?
changed it?
It is moving them incrementally, but it is not moving them rapidly enough. I think all the evidence is that if you're fully vaccinated, including the booster, your chances of becoming seriously ill and hospitalized are immensely lower than if not. But we're not getting that message through to enough people right now.
What do you think is the ultimate play out? You're reading a lot of medical opinion on this right now. I have seen some that suggest perhaps the next variant may get us to herd immunity. We could be immunized enough from enough people having the Omicron variant that it could turn out to be the right blessing in disguise, despite some of the deaths and the hospitalizations you're talking about. What do you sense that this is perhaps breakthrough territory that we're entering?
I think that is somewhere between possible and likely, but we're not there yet. And the strongest defense that anybody can have right now is to get vaccinated, and then hopefully between the vaccinated and those already infected, we'll reach that herd immunity. But in Arkansas, we're a ways away from that.
Let's turn our attention to Medicaid. The state budget hearings have begun for this next fiscal year and the fiscal session coming up in February. There's been a lot of growth in Medicaid over the last 2 years, tens of thousands of children, tens of thousands of adults. Tell me why that is.
Well, I have more of a historical perspective perhaps than others. When I took the Medicaid director's job 35 years ago, the budget was only $250 million for a program that covered only the poorest of the poor. If you fast forward to today, the Medicaid budget this year is going to be almost $10 billion. But it's also the largest insurance program in the state by far. It covers, if you go back, I think to the November numbers I saw, we covered about 1 million people. 1 in 3 people in the state are insured by Medicaid. And obviously the budget's growing. We know healthcare inflation outstrips the rest of the economy, and Medicaid has to do its part for that. So it's a big number, but Medicaid has a lot of work to do.
When you talk to legislators about controlling state budget, when you talk to them about, managing the state's finances, Medicaid always comes up in that conversation because it is such a big component of it. What are some things that we're doing that you feel help us manage the growth in that or control how much Arkansas is on the hook for that?
I think if you look at the Our Home program that DHS has launched, trying to address specific expensive concerns like maternal care, and others, I think we have the potential to start to get some of that in hand. I think we have to do more probably on the pharmacy side. Pharmacy is growing more rapidly than anything. I mean, your commercial insurance programs are paying more out in pharmacy now than hospitalization in many cases. So we have to do more, and we're working on that with DHS on some very expensive drugs, particularly the compounded ones. But when Medicaid insures the majority of the kids in the state, 3/4 of the deliveries, 75% of the nursing home patients, you have to try to look at where the money goes. And again, I think the AR Home effort directed at children and maternity issues is one thing that I think is going to help.
When do you think we'll start seeing the results from that? This is a slow process. It's an iceberg process to make some changes in some things like that.
We're an unhealthy state. We have maternal outcomes that are right near the bottom. And it's a hardship to turn around in the right direction. So it's a process that's going to stretch out over the next few months, the next few years. You don't get it done till you start, and I think the state's making an effort, but it's not going to come quickly.
You and I traded an email sometime in the last week about the Mark Cuban effort to bring down drug prices. You mentioned drug prices earlier. Yes. Is this a pie in the sky notion that he's pursuing, or do you see some real possibility?
Well, he's not the first billionaire to take on healthcare and say, I'm going to make it cheaper, and particularly pharmacy. I think about Jeff Bezos and some others that have made big talk, and then nothing happened. So I'm skeptical about that. He's obviously got to be talking about a serious mail order pharmacy program, which is always fraught with political peril. I can tell you from many years as the Medicaid director, the politics of retail pharmacy are quite challenging and interesting. So I wish him luck, but I again am skeptical that the owner of the Dallas Mavericks can really do much to lower the price of drugs. I'm sorry, it just. All
right, last question for you. Look into your crystal ball. What are we going to be talking about at the end of 2022 in terms of healthcare and health policy?
I hope we're going to be talking about the tail end of COVID, at least to where it is a manageable seasonal event like the flu. I think that's likely. I certainly hope it is. I think we're still going to be talking about the cost of drugs. We're going to be talking about the Medicaid budget. And we're going to be talking about who's covered and who's not, because the state has to go through a re-enrollment process for Medicaid once the emergency declaration ends, which is set for June 30th right now. So we're going to work with DHS to reach out to obviously a lot of these people that have got to make a new application because their eligibility has been protected during the pandemic. But I know Secretary Gillespie's estimated that when everybody has to go through the re-enrollment process, as many as 30% could drop off the rolls, which has an impact for how they get covered. It impacts the providers. So, after June 30th, when that starts, there's going to be a lot of attention and work and news around this re-enrollment process. So that's going to stretch out, I think, till the end of 2022.